Surgery is the cornerstone in the primary treatment of ovarian cancer, followed by subsequent chemotherapy with platinum combinations. But what is the role of salvage surgery in the relapse setting? We know it's feasible. We know there are several data showing that patients who achieve complete resection live longer than patients who not. But is it really better than chemotherapy alone? That's the reason why we initiated this trial in patients with platinum-sensitive ovarian cancer using the AGO score, including complete resection at first surgery, no ascites or less ascites than 500 milliliters, and good performance score in a platinum-sensitive setting to increase the number of patients where we are able to achieve complete resection, and to randomize these patients to surgery followed by chemotherapy or only chemotherapy. It was a very tough study because patients like to do surgery, but we were able to do a randomized trial internationally, and we have shown firstly that a surgical trial is feasible in a multi-center setting, multinational setting, and in our study we have a high rate of complete resected patients, around 70%, with a high rate of bowel resection, a high rate of upper abdominal surgery including splenectomy, and the morbidity was very low, much lower than in the most published data for monocenter studies. And the interim analysis showed a clear significant benefit in progression-free survival. And if you compare this with the other trials with medical therapies, much better, much longer. And we are waiting now for the overall survival data. Maybe in 2019 the data will be major enough. And what we can say today is we should offer second surgery in platinum-sensitive ovarian cancer in combination with the chemotherapy as a feasible option in very, very trained centers. But it's not a must, it's a can option because ovarian cancer relapse is a chronic disease. And allow me one more comment, that the AGO score was designed to increase the number of patients where you achieve complete resection, but Charité has published, the Gynecology has published the data that even if the AGO score is negative, we are able at least in 50 to 60% to achieve complete resection. So it's not for the clinical day decision to say surgery yes or not. So we think it's a valuable thing, and we are so proud for the very first time to present these data, and I think it will change the standard of care.